Are you suffering from a knee pain? Do you have a meniscal tear, a partial ACL tear, or do you have arthritis? Today I want to show you a very simple tool that you can use on yourself to decrease your pain and improve stability in your knee. I'll be showing you how to put on Kinesio tape on yourself. It's simple and it's easy and it's very effective for many people. My name is Dr. Shep. I'm a doctor of sports and spine medicine. Let's jump into it. The materials you'll need are pre-cut KT tape, a roll of KT tape, scissors if you're using a roll, clean and dry skin, a towel, and possibly alcohol pads. First, preparation. You want to make sure you start with a clean and dry skin. Use a paper towel or alcohol pads to clean your skin from oils and lotion. When I'm using KT tape on myself, I like to do it after I shower when my skin is fully dry and clean. But in the office, I use alcohol pads to clean the skin of my patients. Then cut or prepare the strips. If you're using a pre-cut KT tape strips, then you go to the next step. If you're using a roll of KT tape, cut the tape into strips of the right length and round the edges of each strip to prevent premature peeling. Very important. Next, position the knee in a comfortable and slightly bent position, usually about 30 degrees. This is the optimal position to put on KT tape for most people and could reduce the tension on the meniscus if you have an injury there. Now, apply the strips. To apply the tape for a maximum results, the amount of stretch or tension that you want to use is approximately 25 to 50%. And the way you figure it out is you stretch it 100% and then you back off to 50%. This is based on a lot of research showing that this is the amount of tension, the optimal amount of tension to reduce swelling in the joint, to reduce muscle fatigue, and to provide joint stability. If you want to correct an unstable joint, you'll be using more than 50% tension. And if you want to use that amount of tension, I highly advise you get a supervision from a physiotherapist or a physician. Generally, the rule that I follow is less is more. Start with less tension and gradually increase on the following visits. You don't want to apply too much tension the very first time. Otherwise, you could cause increased pain. Better start with less tension and gradually ramp it up. KP taping should be a pleasant experience and should only provide relief. For example, I had a negative experience where a therapist applied too much tension to my upper back, trying to correct my posture, but she overcorrected it too much and caused me a tension headache. And as a result of that, I had a negative experience and I didn't try KT taping again for 4 years. So less is more with KT taping. Now back to the knee. For the knee, apply the first tape on the inside part of the knee, below the kneecap to the lower leg. Rip off about 3 centimeters or about 1 inch. This is your anchor that you will not stretch. The rest of the tape you will apply at approximately 40% tension, and you will press it against the inside part of the knee, right up to the quadricep. And at the end, of course, you will not put any tension at the end of the quadricep muscle. Then you'll do the same on the outside part of the knee, crisscrossing the anchors below the knee. Then we'll apply 2 strips to the medial and lateral side of the knee for extra support, again giving approximately 40% tension. And finally, smooth and activate. Gently rub the tape to activate the adhesive, the glue, to improve adhesion to the skin. There are many KT techniques to stabilize the knee. This is just one of the techniques that I'm showing you to stabilize the entire knee. If you have pain either on the inside or the outside part of the knee, I advise you to see a medical professional so that they could show you a technique that's specific for your injury. KT taping is amazing. I've seen it work as a standalone treatment for countless knees and injuries, but more often than not, it is best when you combine it with other modalities, especially physical therapies and regenerative injections. So let me know if you like this video. Let me know what other joints you'd like to see me tape in the comment section below. Press like and subscribe. Have a great one.